Evaluation and management are cognitive services in which a physician or other qualified healthcare professional diagnoses and treats illness or injury. It includes all non-procedural services which leads to diagnosis and treatment of diseases. They may take history, physical examination, ordering lab investigations, interpreting test results, or decision to perform a procedure. Or it describes physician-patient encounter. They should get payment for all those cognitive services. So appropriate coding of evaluation and management services is our responsibility. E&M services are broadly classified as office visit, hospital inpatient or observation care visits, and consultations. Certain categories are again divided into subcategories. For example, office visits are divided into subcategories new patient and established patient. Hospital inpatient or observation care are divided into subcategories initial visits and subsequent visits. A new patient, the patient new to the provider. According to CPT textbook, a new patient is the one who has not received any professional services from the physician or other qualified healthcare professional or another physician or other qualified healthcare professional of exact same speciality and subspeciality who belongs to the same group of practice within the past 3 years. They have given a time frame, past 3 years. In those past 3 years, the person has not received any professional services. From whom? From the physician or other qualified healthcare professional of exact same specialty and subspecialty, and they must belong to the same group of practice also. In this definition, you can see some words: professional services, speciality, subspecialty, same group of practice. What are they? What is a specialty? It is a branch of medical practice focused on defined group of patients, diseases, skills or philosophy. For example, paediatrician is a specialty. Neurologist is another specialty. Dermatologist, anesthesiologist, psychiatrist, infectious disease physicians. They are in different specialties. And subspecialties are the narrow field of professional knowledge or skill within a specialty. For example, internal medicine subspecialties included cardiology, endocrinology, gastroenterology, infectious diseases, pulmonary diseases, etc. And when advanced practice nurses and physician assistants are working with physician, they are considered as working in the exact same specialty and subspecialty as the physician. What is professional service? They are face-to-face services rendered by physician and other qualified healthcare professional who may report evaluation and management services. Same group of practice is defined by TIN number, tax identification number. It is the matter of income tax department. There are certain large multi-speciality practices in which several doctors are working under same tax identification number. You can see other definitions like 2 or more healthcare practitioners who are members of same legally organized partnership or professional corporation like that. But as per reimbursement point of view, group of practice is doctors with same TIN number. We have seen who is a new patient who has not received any professional services within past 3 years. But an established patient is the one who has received professional services from physician or other qualified healthcare professional or another physician or other qualified healthcare professional of exact same specialty and subspecialty who belongs to the same group of practice within past 3 years. Let's check the decision tree of new versus established patient. Before that, Why the differentiation between new and established patient is this much essential? Because it largely affects reimbursement. A new patient visit requires additional work than established patient. It carries higher relative value units because the doctor has to do from initial assessment onwards if it is a new patient. Here, has the patient ever received any professional service from any provider in the practice or group? If no, the patient becomes new. If yes, check if the patient has received the professional service from physician who is reporting the current service within the past 3 years, either at same location or different location. Sometimes the physician may change his location. At that time, the tax ID may get also changed. Not necessary always. May get changed the tax ID. If yes, the patient becomes established because the same doctor is reporting the service. The physician has maintained a face-to-face relationship at that time. So even though the tax ID becomes different or the location becomes different, that doesn't matter. The patient becomes established patient. If the criteria is no, check has the patient received any professional service from any of the provider of exact same specialty in the practice or group within the past 3 years. If no, patient becomes new. And if yes, check has the patient received any professional service from a provider of exact same specialty within the past 3 years, or is a provider of different subspecialty now providing care. And we find that the providing physician now providing care is of different subspecialty. But if the subspecialty doctor and the physician who is reporting the service has the same tax ID, if yes, patient becomes established, and if no, the patient becomes new. A patient present to emergency department with chest pain. The ED physician orders EKG, which is interpreted by cardiologist on call. The patient is sent home and asked to follow up with the cardiologist next week for coronary artery disease. Here, in emergency department visit, the ED physician orders EKG, but interpreted by cardiologist on call, and the cardiologist is not seeing patient face to face. At that visit, cardiologist can bill 93010 ECG routine 12 leads interpretation and report only. And for the next visit, that means the follow-up of patient with cardiologist, he can bill new patient visit, not established patient. Why? The cardiologist is seeing the patient face to face for the first time. In the previous visit at emergency department, he was not seeing patient face to face. So, the current visit is new patient visit only. Another scenario, if the doctor changes his practice and some of his patients wants to see the same physician and the physician has changed his tax ID. The physician has changed his practice. That means he has changed his place and has changed tax ID also. But some of his patients want to see the same doctor. Even though he has changed his place and changed his tax ID, the provider has already seen these patients and has an established history. He cannot bill new patient code just because he is billing in a different group. Here, this is the criteria. Has the patient received any professional service from physician who is reporting current service within past 3 years, either at same location or another location? If yes, the patient is established. Here, the patients are established patients. If the child is transferring from paediatrician to family medicine when he grew up, but the family medicine doctor is in same tax ID. Even though the doctors are with same tax ID, he is changing the speciality, so the patient becomes new patient itself. If the doctor of medicine sends a patient to a mid-level provider, for example nurse practitioner or physician assistant, provided the mid-level provider is also from the same specialty. Here, the nurse practitioner or physician assistant could bill established patient code. If the nurse practitioner or physician assistant are from different specialty, in that case, they could build new patient code. Let's check factors to be considered to differentiate new and established patient. Medicaid plans require obstetric providers to bill an initial prenatal visit with new patient code, even if they have seen the patient within last 3 years. For initial prenatal visit, always bill with new patient code. Medicare considers hospitalist and internal medicine providers the same specialty even though they have different taxonomy numbers. When advanced practice nurse and physician assistants are working with the physician, they are considered as exact same specialty and subspeciality as the physician. In emergency department, every patients are new patients. If one provider is covering for another, the covering provider must bill the same code category that regular provider would have billed. That means if the patient is new to the regular provider, then for the covering provider also the patient is new.